will now be recorded.
Welcome. I'm Brooke Dennison, Executive Director of YWCA in Canton, Illinois, and we are celebrating our 40th annual Salute to Women of Achievement. Though we couldn't be in person, we are so honored to be joined today and by Gwen Alexander, YWCA Board of Directors, also speaker, author, and podcast host, and our YWCA 2021 Women of Achievement National Global Impact, Dr. Whitney Krueger. Whitney, it's a timely recognition, certainly since you are an epidemiologist who has been really, performing life-saving and life-preserving work for more than 15 years that's impacted us nationally and worldwide. And we're also so proud because you are a YWCA Little School Preschool graduate. So we're just so excited. And before we get started, I also do want to thank our sponsors. Without their generous support, this event would not be possible. So thank you so much to Bank of Farmington, CEFCU, Cook Medical, Crawford's Home Furnishings, Edward Jones, Rusty Melhouse, Kiefer Financial, Key Sweater Insurance, Monocle's Pizza of Canton, and Rhodes Real Estate. So thank you again. And with that, I'd like to turn it over to Gwen for the presentation.
Thank you, Brooke. It's my honor to introduce everyone to Dr. Whitney Krueger. Girls with dreams become women with vision. It's a quote the YWCA found once and put on a t-shirt for the 3rd through 5th grade girls in YWCA's Why We Run program. We love that quote so much, we mailed that t-shirt to Dr. Krueger along with her National Global Impact Award for YWCA's 40th Annual Salute to Women of Achievement. We thought the quote was fitting for recognizing Dr. Krueger's astonishing career in medicine. At the time, we didn't know the backstory. Now that we do, it couldn't be more fitting. Whitney Baker Krueger, PhD, is the daughter of Gary and Deb Baker, formerly of Canton. A Canton High School graduate class of 2000, Dr. Krueger is currently the Associate Director of Epidemiology at AbbVie, a highly focused research-driven biopharmaceutical company based out of Lake County, Illinois, with research centers spanning the globe. And while today you won't find Dr. Krueger jet-setting all over Africa and Asia, she did before. She describes those dreams, while exciting and intense, as taking a more practical turn as she works on research at her home in Chapel Hill, North Carolina. There, she resides with her husband, Dr. Brian Krueger, also a renowned scientist. Dr. Whitney Krueger holds a PhD in epidemiology from the University of Iowa. Her journey, following graduation from Canton High School, took her to the University of Miami to study microbiology and immunology. Whitney transferred to the University of Illinois, where she earned a Bachelor of Science degree in microbiology. She went on to the University of Iowa, earning a master's degree in public health prior to completing her PhD in epidemiology, also at the University of Iowa. Early in her career, Dr. Krueger worked as the research study coordinator for the University of Iowa Center for Emerging Infectious Diseases. In 2006, that led her to become the on-site field research coordinator for the U.S. Department of Defense's Naval Medical Research Unit in Cambodia. As Dr. Krueger describes it, the U.S. Navy had established a laboratory site in Indonesia, and they brought her on board to establish a laboratory in Cambodia. She was the only English-speaking employee in the lab. Dr. Krueger partnered with a local guide and traversed the countryside looking for ducks. That's how she described getting started in her research there. She would identify field sites in order to find subjects. Her research subjects were agricultural workers. Ultimately, Dr. Krueger implemented a 3-year study of bird flu among 800 poultry workers in Cambodia. This involved speaking with the villagers to get them enrolled in the study, establishing relationships also with the Ministries of Health and Agriculture, the National Institute of Public Health, and local health departments. Notably, Dr. Krueger's work overseas coincided with U.S. military installations. Her research efforts were intended to keep our troops safe and to help the countries with their own capacity building. For the next 10 years, Dr. Krueger spent her career investigating hardcore zoonotic diseases, understanding transition dynamics, looking at the pandemic potential in novel animal pathogens. Dr. Krueger coordinated and led field teams in a CDC-sponsored study at state fair swine shows that found the first evidence of the 2009 pandemic H1N1 virus in U.S. pigs and produced epidemiological data to show asymptomatic pigs were bringing the virus to the state fair and infecting attendees. Dr. Krueger also studied veterinarians and dog breeders attending dog shows to find test subjects. In studying outcomes of human exposure to dogs, Dr. Krueger studied a coronavirus. She was the senior research study coordinator epidemiologist at the University of Florida's Emerging Pathogens Institute, where she applied infectious disease epidemiology research at the human-animal environment interface for several years. And Dr. Krueger's efforts were vast and impactful. She coordinated a U.S. Department of Defense, U.S. Department of State, and CDC-funded graduate level certificate program in One Health that trained 192 international public health, veterinary health, and environmental health professionals from 24 countries to increase in-country research capacities in developing and implementing One Health-based national plans to combat emergent disease threats. Dr. Krueger was a postdoctoral fellow for the United States Environmental Protection Agency, working in the epidemiology branch in Raleigh-Durham, North Carolina. She analyzed human health risks due to environmental exposures. And then she pivoted and went into researching drug safety and therapeutics. That's the safety and efficacy of vaccines. This shift led to her studying autoimmune diseases. In this venture, Dr. Krueger worked first for RTI Health Solutions as a research epidemiologist. She is a highly published scholarly author, and she received the highly cited author award by RTI International in May of 2018. This award followed her early career author award, also by RTI International in 2016. Among her many published works, one can find some of the other projects Dr. Krueger has dedicated time to tackling. Examples range from evaluating the safety of medication exposures during pregnancy, a case study of study designs and data sources in multiple sclerosis, to elevated blood lead and cadmium levels associated with chronic infections among non-smokers. Her published works also include her globe-trotting research. Besides studying bird flu in Thailand and Cambodia, Dr. Krueger published a study on identifying risk factors for zoonotic influenza transmission to men in Nigeria, Romania, and Mongolia. Significantly, she also promoted evidence-based policy recommendations for influenza pandemic preparedness, including co-authoring 3 editorials arguing for the inclusion of agricultural workers in national pandemic plans and improved industry transparency. Her latest position in biopharmaceuticals at AbbVie has involved her leading a global epidemiology team supporting clinical trial design and real-world studies in autoimmune conditions like Crohn's disease, psoriasis, and rare autoimmune conditions. Since the COVID-19 pandemic, Dr. Krueger has been wearing 2 hats, giving her background studying coronavirus and all things fueling pathogen emergence. Dr. Krueger is proud to work for a company who responded like they did when COVID hit. AbbVie developed an antibody treatment for COVID-19, and Dr. Krueger has helped develop academic research around COVID. Specifically, she has been involved in a population study of COVID-19 in Lake County, Illinois. She has studied how many people have antibodies and paired it with risk factors in the state's mitigations. Via AbbVie research, she has taken a global look at data points like wind, politics, and race as predictors of death rates of COVID-19. An indication of the path she would travel, University of Iowa's Department of Epidemiology bestowed an early honor on Dr. Krueger, awarding her the Sherry S. Chanhardy Memorial Scholarship for exemplifying professional inquisitiveness, determination, and purpose. YWCA had the opportunity to speak with Dr. Krueger about her inquisitiveness for infectious disease. And Dr. Krueger recalls falling down the rabbit hole of infectious disease inquisition, the result of an assignment by her 7th grade teacher, Mrs. Roosh, while attending Ingersoll Junior High School. The story goes, Mrs. Roosh gave a broad research assignment. Find a topic you know nothing about and research it. And Whitney found herself at Parlin Ingersoll Library pursuing the stacks before she ended up in the periodicals. She saw the then cover of Newsweek with researchers clad in head-to-toe protective gear due to the Ebola outbreak in Africa. She researched the Ebola virus and she was hooked. In high school, she frequently talked of living in a hut in Africa one day, and the license plate on her classic car read Outbreak 5, which is captured in a treasured senior picture. Besides a great assignment by Mrs. Roosh, Dr. Krueger emphasized the support of her parents when it came to her goals and her dreams. They have always been encouraging and are adventurous themselves. Dr. Krueger had a strong foundation for her science adventures, and we are all the better and safer for it worldwide. When asked what advice Dr. Krueger would give her younger self or any young students, she replied that sometimes young girls don't see their value. Sometimes they put their value on things outside of themselves, like relationships or boyfriends. Dr. Krueger would encourage girls to be inquisitive about themselves, to think about what they want, what they'd like to do, and what would bring them purpose. She says, you can make your own path, is encouragement from Dr. Krueger, and we agree. In the words of retired Ingersoll Middle School science teacher Jenny Beal, congratulations, Whitney. You have followed your dream and your accomplishments have made for a better world. And on behalf of YWCA, congratulations on achieving such national global impact, and thank you for all your efforts.
Yay! Thank you so much, Dr. Krueger, and thank you for being with us.
Yes, well, thank you. Thank you for having me. This is great. Thanks. Yeah,
So
oh, go ahead.
Sorry. No, I'm so sorry.
Oh, no, I just wanted to say thank you so much to Brooke and to Gwen and to the YWCA and the board of directors for thinking of me for this award. You know, it's truly an honor to be acknowledged by my hometown after being away for so many years.
Well, we have especially been following you this year, certainly. And, you know, we're appreciative for your guidance and to be able to have that connection to you as hard as this year has been. We're just grateful. And what an amazing story. You know, it's fascinating that you made a decision very early on in your life, and you stuck to that, and you made choices along the way to pursue your goal. And we're so thankful to be able to share your story with other young people who are here, who are walking the halls at Ingersoll Middle School. You know, we have the Girls Unplugged program, and we will share this. We will share your bio with them. What an inspiration. And so just thank you so very much. We're just honored and really inspired by you.
Yeah, that would be great. You know, you can find your passion anywhere. So just figure out what you love to do and go for it. So I can't explain how that happened, but you know what, once I learned about infectious diseases, I was hooked, and that was it. So, you know, whatever it is for you, find it and go for it.
Yeah, well, it's just wonderful. Thank you again. We know you have a lot of work to do, and so we won't take much more of your time, but thank you.
Great. Thank you guys. This is awesome. Yeah. I really appreciate it.
Thank you. And thank you, Gwen.
You're welcome.